everyone. Hope you and your family had a happy and safe Thanksgiving holiday. Thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and science so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Our first question comes from Julia from Boston, who asks, I was fully vaccinated in March 2021, so I'm now eligible for a booster vaccine. I have plans to travel abroad in 2022. For maximum protection during my travel, should I get a booster vaccine now or wait until shortly before I travel next year? Julia, I love this question because I haven't gotten it before and it is a great one. Now, because we know that the antibody levels from the first two doses of Pfizer and Moderna vaccines start to wane at around 6 months and infection risk increases then as well, you're right to wonder whether the benefits of the booster will also wane. So maybe you want to time your booster for maximal benefit when your risk is highest. The problem is, we don't know if the third shot will wane the same way with lower levels of protection at 6 months again, or if it will last longer, or if the third time is a charm and it will last forever. We have to wait and see. And cases are rising in New England pretty quickly. So your risk is increasing every day right now. So for those reasons, I think I would suggest not waiting for a theoretical future benefit and getting the benefit of the booster now. Our second question comes from Wendy in Newton, who says, my 20-year-old son is in college. He's otherwise healthy. Should he get a booster? Wendy, boosters are authorized by the FDA for everyone over the age of 18, as long as you're at least 6 months from your second dose of Pfizer or Moderna, or 2 months from your J&J vaccine. But the CDC makes a purposeful distinction between those who may get a booster and those who should get a booster. That's because the vaccines still protect really well against severe disease. So if you're young and healthy and fully vaccinated, you're pretty safe already, and it's your choice. Our last question was sent in from Alexandra, who lives in Marblehead. She says, the latest data on the recent uptick in COVID-19 is showing that the largest number of new cases are in children ages 5 to 9. But now, children 5 to 11 can be vaccinated against COVID-19. So when and how will the mask mandate in public schools finally be lifted? Well, COVID cases are rising for sure. And when COVID cases are up, they're going to manifest predominantly in the unvaccinated, a population which right now is made up of a lot of children. Now, children are low risk for severe COVID, but not no risk. So it's a good thing that many are getting vaccinated right now. The state's school mask mandate is set to expire on January 15th. And many families are ready for their children to learn without masks on, but many are not. Given how protective vaccines are, some experts feel that as long as every family has had the opportunity to fully vaccinate their child, so say about 8 weeks or so after vaccines were authorized for kids, that's when masks should become optional regardless of case rates. And I think that idea has a lot of merit. Others feel that case rates should be below a certain threshold, or that a certain vaccination rate should be achieved in a school building before switching to optional masks. And some schools will probably follow those metrics, although I think they'll struggle to figure out what the right metrics are. And I really worry that there will be widely differing practices from town to town, and that's going to be confusing for people. The most important thing is for communities, school boards, and health departments to be talking now about what needs to happen to switch to an optional mask policy later. But if they're waiting for COVID to be over, unfortunately, that's not going to happen. That's all the time we have for this week. You can send me your questions about the pandemic, this year's flu season, or anything else related to infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.